I laid back in the bed, felt dizzy. I said, "Mom, I think I'm gonna pass out." And I did.
I need some help in here. I need a doctor. I need some nurses.
When Kyle went into cardiac arrest, it was surreal watching this happen to your child and having no control.
At the time, if I really was able to comprehend what was going on better, I don't think I would have been able to handle it. I think it would have been a very different scenario, and this would be a very different movie.
Kyle has an incredibly rare disease called LCHAD, where he can't break down fats properly. The disorders can affect his skeletal muscles and cause their breakdown. LCHAD also can cause the heart to fail quite suddenly when its energy demands are quite high.
Another round of epi, please. No pulse, VFib. Katie, can you get the defibrillator charged?
Yep. I'm all charged.
Everybody clear?
Clear.
Shock. During the resuscitation, it became clear that what we were doing was not getting his heart to function the way that it should.
I don't feel a pulse.
I don't think we're going to get him back without ECMO. Can you call the surgeons and the perfusionists?
The time that I ran into the room, he was fighting, and he wasn't giving up. I've never seen nothing like it.
ECMO is basically a heart and bypass machine. It takes a portion of the patient's blood out of the body, it brings it through an oxygenator to give it oxygen and take away carbon dioxide, and then it gives it back to the patient. It doesn't fix anything, but it gives patients time.
Look at those arms. Oh my God.
My job was really to look at Kyle from the standpoint of an expert in rare diseases. We had to think more about his long-term prognosis and whether we thought he would be able to come off ECMO.
Dr. Michele Spencer-Manzon thought that we could trial this medication reversing the problem with his heart.
The medication has been used in 5 similar cases and has very successfully caused the heart to recover. So in discussions with Dr. Giuliano, I felt very confident that this medication could give him a fighting chance to move forward and get better.
And that's when we moved forward with ECMO.
Got good flow, up to 1 liter.
Sats are coming up. Well, if the medicine hadn't worked, then at some point we would have had to have disconnected Kyle from ECMO, and likely he would have died.
3 months later, we're here at Hospital for Special Care, and he's made leaps and bounds of progress. The aquatherapy has been the best therapy for him and will continue to do that when he goes home.
When I first got in the water, I could barely move. Now I am able to partially walk in the water. I can tread water and support my whole body.
Dr. Giuliano and his team, the ICU, worked harder to save Kyle than I have ever seen any team work in my 14-year career as a nurse at Yale.